The M29 midterm. A safe, easy-to-insert catheter for intermediate dwell applications of up to 29 days. The only midline catheter that provides a built-in barrier against catheter contamination during the insertion process. The right line from the start. To begin the insertion process, gather the equipment necessary for insertion of the M29. A typical kit would include 2 pair latex-free sterile gloves, sterile tourniquet, face mask, sterile tape measure, M29 safety introducer, M29 in the sterile sheath, sterile regular and fenestrated drapes, chlorhexidine applicator, extension set with cap, sterile gauze, sterile flush, sterile tape, transparent dressing. Remember, hand hygiene is the single most effective way to stop the spread of infection. Be sure to follow institutional protocol when performing this procedure. To prepare for venipuncture, abduct the arm 45 to 90 degrees, assuring that the patient is comfortably positioned. Apply the tourniquet 6 to 8 inches above the antecubital fossa. Choose a vein that is both visible and palpable and free of obvious complications. The M29 is intended for insertion in the larger vessels near the antecubital fossa, which makes venous access quick and easy in most cases. Suitable veins for insertion include the basilic vein, the median cubital vein, and the cephalic vein. Remove the tourniquet, leaving it under the patient's arm for reapplication. Don a pair of sterile gloves. Clean the insertion site with a chlorhexidine applicator per your institutional protocol for skin antisepsis. Assure that the skin is completely dry prior to venipuncture. Reapply tourniquet. Remove and discard gloves. Don new sterile gloves and place fenestrated drape over insertion site. Remove cap from catheter sheath and assure that the tip of the M29 is visible. If necessary, advance the M29 slightly by pinching the catheter behind the bellows and pushing forward until the tip is visible. Remove the needle guard and make sure that the needle tip is fully visible. Perform venipuncture, observing for blood return. When seen, lower the angle of the introducer slightly and advance catheter into the vessel. When fully inserted, remove the needle and apply digital pressure to the vein above the introducer tip to slow the backflow of blood. Push the button to activate the needle safety feature. Firmly insert the tip of the M29 into the hub of the peel guard until it clicks into place. Grasp the sterile drape and loosen the tourniquet to allow the catheter to be advanced. Advance the M29 by grasping the catheter behind the bellows. Push forward and release the catheter repeatedly until the entire catheter has been advanced and the catheter hub is visible within the bellows of the sheath. Click the catheter hub into the hub of the peel guard. You will feel it engage. Remove the sheath while holding the peel guard firmly in place. Continue to support the peel guard and slowly remove the stiffening wire. Then attach the extension set. Grasping the wings of the peel-away sheath, split the sheath and peel it away from the catheter. Note that the peel guard eliminates any stress on the insertion site or migration of the catheter during the removal of this peel-away sheath. Cover insertion site with 2x2 gauze to act as a wick for any bleeding from the insertion site. Attach a saline syringe to the extension set and aspirate a small amount of blood to confirm correct placement of the catheter in the vein. Flush per institutional protocol. Clamp the line, remove the saline flush, remove the drape, and cleanse the site. Catheter securement and dressing is a matter of institutional policy and typically involves application of the securement device and a transparent dressing, such as the SorbaView shield. To properly use the shield, peel the upper backing off the large window on the dressing. Center the window over the insertion site. Press down on all sides of the dressing until it is secure against the skin. Remove lower backing by pulling the tab down towards the extension set. Join the edges of the dressing at the extension set. Then press firmly around the entire dressing to ensure maximum adhesion of the dressing to the skin. Complete the process by applying the universal tape strip snugly under the tubing and over the edge of the dressing.